From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin and Treloar. This episode of Care Experts is brought to you in partnership with Sono Bello, America's #1 cosmetic surgery specialist. Today, we're joined by Dr. Christopher Chung, a medical expert at Sono Bello and a leader in aesthetic treatments, who will guide us through the latest trends shaping the future of body contouring and cosmetic surgery. From emerging procedures to how patient expectations are changing, this conversation is your inside look at what's new and what's next in the world of aesthetics. Let's get into it. Hello, everyone, and welcome to the Care Experts podcast. I am thrilled to be sitting down today with Dr. Christopher Chung. Dr. Chung, thank you so much for being here.
Thank you for having me.
When I was reading through your bio and the awards that you won, I mean, my jaw was just dropping. It's incredible. What made you get into this industry?
I've been a board-certified plastic surgeon for over 20 years. And not to bore anyone with the whole process, but at least back when I was in training, we had to do a full general surgery training. So I'm a fully certified general surgeon as well. And during that time, you have exposures. You have exposures to different specialties of surgery, one of which is plastic surgery. And plastic surgery is really, in essence, about form and function. It's about function in terms of restoring function. That's really what a lot of reconstructive plastic surgery is. Then it's about enhancing the form, which is really about the aesthetics. And so it really sort of resonated with me in terms of both of those elements. I tend to be pretty detail-oriented. I've always been. But, you want your plastic surgeon to be very detail-oriented.
Absolutely.
I would hope so. I hope you're not going to say, it's good enough. I think, we're done for today. So everything's just sort of fell in place for me. So I can't tell you like there was a light bulb moment or anything of that nature. But it's just a gradual sort of realization that that would be a field that would be most befitting for me.
And I can only imagine, as you've continued to practice over the years, that seeing not only the results physically, but the results emotionally, mentally that people experience in having this type of procedure and the way that that makes them feel in their body and their ability to go out into the world has been interesting, to say the least.
Oh, gosh. I mean, that's the reason why I do what I do. Yes, I mean, the bodily changes are wonderful. And people get tremendous satisfaction from it. But really, the gratification point is about how they feel about themselves. And you see it. I see patients walking down afterwards, and they're wearing different clothing. They're wearing clothing that they couldn't ever wear before. I had the confidence to wear before. And I tell you, as many patients as I've treated, and thousands, you take all those numbers away, and you just see that one patient walking down, and you see the smile on their face, you see the twinkle in their eyes, you see them wearing something that they've never had the confidence to wear before. It makes it all worthwhile.
I love that. I want to talk to you today a little bit about some of the trends that you're seeing. Obviously, working with Sono Bello for a number of years now, you have over 65 clinics. You are seeing the trends. What are you noticing, or what have you noticed even in the last 5 to 10 years that's changing in this world?
Oh, a lot, right? I mean, we live in a world of technology. There's almost impossible for technology to sort of work itself into every industry, including ours. And I think that's where it's really for the better, because there's some wonderful technological advancements in terms of safety, in terms of efficacy, in terms of recovery, and in terms of just being able to diagnose. And so, I just see that as a starting trend. I think more men are getting into cosmetic surgery. It's not just for the ladies. I think men are feeling like, hey, don't forget about us. I think at one point, a lot of men said, I'm not going to get cosmetic surgery. But, I think men are realizing, hey, no, I think it may benefit me. And it certainly would and does. And so I think we're seeing an increasing trend of men coming in. And I think people are being a lot more holistic and sort of thinking along the lines of being prevention as opposed to reaction. And so there's a lot of younger patients sort of coming in, and they don't need anything drastic,
Yes.
but they're sort of saying, hey, why don't I start this journey so that I don't end up with this and that? And so I think we're seeing a lot of that coming into play as well.
Dr. Chung, how is Sono Bello staying ahead of the curve in this environment that is just rapidly changing with technology?
Oh, it's hard. It's hard. But, we actually have an innovation center. So we have a dedicated center just to research and development and innovation. And that's where we sort of test all new equipment out, all new devices.
Yes.
We sort of work on innovative approaches to surgery. And that's sort of like our laboratory. And we work things out and make sure. And, not everything that we work on hits sort of our centers,
Yes.
because we want to make sure that we're very rigorous with our process to make sure that it's extremely safe and it's effective. But believe it or not, we actually have our own laboratory.
That's amazing. Are there any treatments specifically that you're seeing, whether that's contouring or liposuction of a specific area, that you've noticed have really blown up recently?
So I think for male chest, speaking about men, we just spoke about men. I think that's one of the very popular areas that a lot of men feel also self-conscious. And they say, hey, I've been working out, I'm in pretty good shape, but this area, and a lot of these areas are genetically driven. It's not really anything that you're eating or not doing or doing, but it's just how you are, and it's in your genes.
Yes.
I think in terms of the current trend, there's a lot of weight loss trend with the GLP-1s. So there's a whole cohort of patients who are saying, look, I've lost a ton of weight. I'm happy with the weight loss, but now I'm left with all this excess skin. What do I do about that? And so they tend to come and seek our counsel and say, what are my options? Because quite frankly, when you have excess skin, there's no way you can just sort of dissolve excess skin. Quite frankly, the only way you can remove excess skin is by removing it surgically. And so now they're sort of saying, are there safer alternatives to tummy tucks and the traditional methods to address skin? And that's really what they come to seek us for.
That's so interesting. And it was definitely one of my questions when we're seeing this rise in the use of GLP-1 weight loss drugs. How is that impacting what you're seeing in your various clinics? So you're saying that skin removal is a big piece where people are coming in to have that tightened. Is that using lasers or is that an actual surgical treatment?
So it's an actual surgical treatment that we apply in conjunction with our fat removal, with our liposuction. It's all done in the same setting while the patients are awake. And the traditional fear is, oh, I can't really spend 6-8 weeks down in bed. I have life to live, I have family to raise, I have work to do. And so that's always been a huge barrier for a lot of patients. But the way in which we've sort of approached skin reduction with our minimal sedation is patients are actually going back to work in 1 or 2 weeks, which is unheard of. And so we're removing some of those barriers to patients getting the treatment that they need in the time frame in which they need it.
If somebody's considering one of these treatments, what would be the first step? How would they determine if they're a candidate or which procedure they should be using? Because if we're being honest, there's so many different options out there, whether it's cool sculpting or lasers or actually going the surgical route. Where would you recommend that people begin that process?
Well, I think a lot of patients, information is really out there. It's rampant. And we encourage our patients to be well educated. And so we encourage, do all the research you want. And then come in and ask us. And then we'll sort of go through that list and we'll tell you what's true, what's not true. And most importantly, we'll sort of put it back onto you, because not one size fits all. So everyone's different. Your desires are going to be different. Your anatomy is going to be different. So the treatment plan has to be tailored to you, that's appropriate to you, as opposed to someone else. And then so I think that's really what the consultation process is all about. I think there's one other very important aspect to the consultation process, and it's not just simply about data mining and data analysis. It's about developing that relationship. You have to find the comfort with that provider and sort of feeling like Does this provider have my best interests at heart? You know, are they simply telling me things that I want to hear? Or are they telling me things that I need to hear? Those are two very different things. And you have to find that trust and that comfort in knowing that not only does this provider have the expertise, the proficiency to be able to conduct the surgery, but will they be there to support me, and are they my advocate? I think that's a immensely important thing that no internet search will ever provide you.
No, it's a feeling that you get in person with somebody. And so the first step, always booking in, going into the clinic for a consultation, bringing all of your questions and having that initial conversation. What would you say are the most common things that people are coming to your clinics to ask for?
You know, patients come in with all sorts of different things, and sometimes they don't know what they need.
Yeah.
They come in thinking that, you know, I think I need a tummy tuck procedure. I think I need this. I think I need laser. I think I need liposuction. And we welcome that because, you know, it's perfectly okay not knowing what you need because that's what really we're here for.
Right.
And to be able to address all your, listen to you, talk to you about the different options, and sort of give you a sense of what's right for you. And at times, like I said, what's not right for you. I think that's just as important to know as well.
As a mom, I have been privy to a number of conversations behind the scenes between moms and about our bodies changing in different seasons of life, whether that's puberty, motherhood, postpartum. There's so much conversation right now about perimenopause and menopause. What are your thoughts on doing these types of treatments in those transitionary stages? How long should somebody wait in order to make an informed decision about whether or not they want to do a surgery? I can imagine, like, you don't immediately postpartum go into a surgery, or maybe you do. I don't know.
No, I think you bring up an excellent point. And while you talked about some of the different stages, let's talk. Would you consider having surgery if you had an important wedding to attend in 2 weeks? No, you would not. So, I mean, I know that's in more of an extreme
Yes.
situation, but like for everything else, you won't really know that until you listen to the patient, until you get to know the patient. And so it's not just talking about the facts. It's not just talking about, hey, I can pinch this fat or you have this extra skin. It's really trying to sort of gain a sense of understanding the entire big picture.
Right.
Where does this procedure, if any, fits into your overall life? And really what's driving this?
Yes.
You know, because having a better understanding of the big picture allows us to help you better.
Yes. I also think that often during those big transitions, there's a lot going on hormonally. It's a transition. So that is going to it's going to present some challenges. And
Yes.
so I can only imagine, especially with younger individuals going through puberty, giving it a moment for things to settle and then making a decision from there will probably ensure that you're getting the results that you're looking for and making those decisions from the best headspace.
I agree. You know, this is a big investment.
Yeah.
It's a big investment in many ways. And so, like with any big investment, you take time. You take time to do your research. You take time to listen to good counsel. You take time to think about it, to discuss with your loved ones, and you make sure that it's the right time to do this. You know, cosmetic surgery will always be here. And so why rush it? You know,
Right.
just make sure that you're doing the right thing for yourself at the right time.
Right. I am somebody who exists in a thinner body. And one of the things that I'm hearing a lot about now is doing liposuction on an area of your body and then transferring that fat to another area, whether that's a breast augmentation or many people are doing it in their face. What are your thoughts on this?
Fat grafting, I think, is a very valuable tool. And I think, you know, you talked about a trend. One of the trends that I didn't mention was about volume restoration, which is a little bit ironic because, right, we talk about liposuction. Liposuction is about taking volume away.
Yeah.
But then there's another aspect of rejuvenation, which is about volume restoring, you know, because what is a youthful face?
Right.
You know, is youthful face just a tight face? No, it's about having more volume. And so a big part of facial aesthetics is about volume restoration. But fat It's your own fat, so you can apply it to different parts of the body. So there are times when we would do fat grafting to different parts of the abdomen. Some people are doing it to the breast for, smallish breast augmentation. Obviously, we all know about BBL, the Brazilian butt lift,
Yes.
where, a lot of fat has been employed to augment the buttock region.
Is that what's happening in that BBL? I've never actually understood. Are they putting an implant in, like a breast implant, or is it usually fat being inserted?
So it's mostly fat,
Okay.
and that's where you augment the buttock region with your own fat taken from
Okay.
somewhere else,
Yes.
and then using that to sort of enhance that region.
Interesting. I am also seeing so much about these insane facelifts that women are getting right now. Some of the celebrities where people are like the Lindsay Lohan, Kris Jenner, where you are seeing something different is happening right now where it's not just tightening. Do you think that they're looking so good these days because they're adding the fat restoration in there as well?
I think it's probably a combination.
Okay.
It's a multimodal approach.
Yes.
There have been some surgical enhancements and innovations in how we do a facelift to make it look more natural.
Yes.
I think that's also another trend that's sort of coming. People are not wanting to look done.
Right.
They're not wanting to look stretched.
Yes.
It's really about you're doing it for yourself.
Yeah.
And so I think less is more. So even when it comes to breast augmentation, I think in the course of the last 3 to 5 years, we've seen women come in asking for smaller implants.
Yes.
And so I think that's sort of the trend that we're seeing right now, and no doubt also in facial aesthetics as well.
I love what you just said there. The trend almost seems like it really is about doing these more minimal procedures where you still look like yourself, just a more refreshed version of yourself. Are you noticing in the techniques that you're using that they are less invasive?
I think that's where technology is really helping. Technology really allows us to be less invasive. And so at Sono Bello, we do what's known as a laser-assisted liposuction, where we're employing and taking advantage of the laser technology to help melt the fat. It also helps tighten the skin, thereby allowing us to use very small cannulas and do it awake. So we're trying to incorporate and take advantage of technology, some new innovations and surgery, bridging all that together to sort of develop a approach that we feel is very safe, very effective, with minimal downtime.
Amazing. I know that finances can be a barrier for individuals who are considering this type of treatment. How can the CareCredit credit card help people who are considering a cosmetic procedure?
Oh, huge, huge. Affordability is a fact of life.
Yeah.
There are a lot of things that we need or want, and that's where CareCredit comes in. It really allows patients to get what they need and what they want.
Amazing. Dr. Chung, we have some great questions from our audience. To start off, it seems like people are way more open about the work they've had done, especially on social media. I've seen so many creators talk about their treatments and even post their recovery. Do you think this transparency is helping reduce stigma around cosmetic surgery?
Oh, absolutely. Cosmetic surgery has become very mainstream, and it shouldn't be anything that we should be embarrassed about. Not at all. I think it's great that we're being very open, talking about it, educating each other, and I think that all portends a great future and continuation of cosmetic surgery.
Are you still seeing most patients after a big life change like weight loss or having kids, or are younger people coming in earlier for prevention?
Absolutely. Definitely, there are some triggers in terms of weight loss, postpartum state, postmenopausal weight gain. But in general, a lot of patients don't really have a trigger. They're like saying, hey, I just want to feel better about myself and I want to start this journey. And I don't want to wait until I'm 70 years old, I'm 60 years old. And so I think that's wonderful.
I'm 32 and I've never had any aesthetic work done, but I've been curious for a while. Is there a good place to start or something more beginner friendly when it comes to body contouring?
I think do all the research. go in and look at all the respective sites, look at the reviews. But at the end, go and see a consultation. That's really what it is. It's free. Come in and just be open and say, hey, I don't think I'm ready to commit to anything yet. I'm sort of starting my journey. But I want to sort of see if this is right for me or what my options are. I think that's a great place to start.
Amazing. Dr. Chung, thank you so much for joining us on the Care Experts podcast. It was such a pleasure to have you here today.
Oh, thank you very much. My pleasure.
Thanks again, Dr. Chung, for joining us. We learned a lot about surgical and aesthetic trends. We appreciate all your expert insight. And thanks to everyone for tuning in. This episode was brought to you in partnership with Sono Bello. Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.